Well, a warm welcome to this talk, Monday the 1st of August. Now, I did wonder if this talk was outside my area of a remit, really, but I've thought about it and I think it's got quite important implications for healthcare and global healthcare, so I want to discuss it. Now, it appears that Pfizer has been guilty of illegal exploitation. Now, this is not something I talk about lightly, and I've got some important reasons that I'll tell you about for talking about it. Now, of course, we have to be very careful here with the evidence. This is mostly coming from this site here from the UK government, from the Competitions and Markets Authority. And we'll be looking at some of the things that has said. Now, let's start off by looking at what this is about. It appears that the NHS has been overcharged for Phenytoin sodium. This is a drug called Phenytoin. I've given this out, I'm sure I gave this out in the 80s, probably even earlier than that. So it's a long-standing, important anti-epileptic medication. Now, anti-epileptic medications are absolutely vital and completely life-saving for many, many people because they prevent generalized epileptic seizures where there's irregular activity throughout all of the brain and the person has what we used to call a grand mal fit. Sometimes there's an aura, the patient is aware of something, of sometimes a sensation like a smell or a taste that warns them they're going to have a fit. That doesn't always happen. Then typically they go into a tonic stage where all the muscles go rigid, and that's really dangerous because you fall over with rigid muscles and you can do terrible injuries to yourself. I've remember an appalling case I was at, the person went rigid and they fell back and they hit the head on the supermarket floor, and I was actually involved there briefly, and I felt the back of the patient's head and I could feel the break in the skull. It was really quite disturbing. So that's the aura-tonic phase. Then the clonic phase is the shaking phase. Aura-tonic, clonic, then they go into a coma after that, and sometimes there can be a period of post-epileptic confusion or even autism or automaticism, where patients do things and don't realise they're doing it. But most patients wake up after the coma and feel pretty groggy. Thankfully, in these generalised seizures, because all of the brain goes into what we call spike and wave activity, the patient becomes unconscious at the very start of it. So even though it looks very distressing for the observer, if you can keep the patient safe during the fit, I would normally put them in some sort of recovery position and just hold the hand and wait for them to recover. Unless they went into status, in which case more treatment would be required. So just mention that just to say how important this medication is. Pfizer was fined £63 million, so I don't know what that is in dollars, 80 odd million in dollars. I didn't work it out. 63 million English pounds, British pounds. The British group, I believe, Flynn, charged 6.7 million. NHS costs rose from 2 million a year to 50 million a year in a single year. To me, that sounds like a pretty big increase. If I went to a shop and my pint of beer had gone up from £2 to £50, I would consider that a pretty big increase. So really quite dramatic increase in the year. Now, this is the Competitions Market Authority Chief Executive Officer, direct quote. These firms illegally exploited their dominant positions to charge the NHS excessive prices and make more money for themselves, meaning patients and taxpayers lost out. Now, direct quote from the site. If this is true, then this is completely appalling because this is the lives of men and women, boys and girls we're talking about here. Fines are the result of an in-depth investigation. Competition and Markets Authority, as we said, Pfizer and Flynn charged unfairly high prices for their capsules. I believe a pack of 100 milligram capsules was up to £67. That's what I believe, it was up to that. Anyway, what's written down here we're pretty confident of. This went on for over 4 years, ultimately paid for by the National Health Service. Now, this is money that could have been used to prevent human pain, suffering and death. The NHS needs money. There's always more to do than can be done. Now, what happened here was firms debranded the drug, previously known as Epanutin, which is what I remember it as. That's what I used to give out very frequently, meaning it was no longer subject to price regulation. Basically, I think they made it a generic. And then the firms could set price at their discretion. So if I had discretion over the price I was paying, I think, I've got discretion over this. What should I charge? Should I put the price down a bit, or should I just put it up a bit? That's what discretion means to me. Pfizer and Flynn were the dominant suppliers of the drug in the UK at the time. The NHS had no choice but to pay the inflated price for this. And that's all on that government site, otherwise I wouldn't be telling you. The details are there, with links to some of the things in the process as well. Do check it out for yourselves. It really is quite, to me, very disturbing reading. Over 4 years, Pfizer charged prices between 780% and 1,600% higher than previously. I mean, wow. That is a big increase. The company supplied the drug to Flynn, apparently. I believe that's a UK company. American. Pfizer's based in the States, of course. Which then sold the capsules to wholesalers and pharmacies at prices between 2,300%. It's not funny. And 2,600% higher than the prices previously charged by Pfizer. Right, and again, taken directly from the site. This illegal behaviour led to the NHS annual costs for Phenytoin capsules increasing from 2 million in 2012 to approximately 50 million the following year. Wow. Andrea Coselli, Chief Executive of the Competition and Markets Authority. Phenytoin is an essential drug relied on daily by thousands of people throughout the UK. Correct. I can vouch for that. To prevent life-threatening epileptic seizures, I can certainly vouch for that. I've had patients, indeed, someone I knew outside of work didn't take their anti-epileptic medication and had a fit in the bath and drowned. These things are so important. Just imagine you're climbing a ladder. Anything like that. Or you could just, as I said before, this lady fell over in the supermarket. These firms illegally exploited their dominant position to charge the NHS excessive prices and make more money for themselves. Direct quote, of course. This is not me saying anything really. Meaning patients and taxpayers lost out. Now, as a patient and as a taxpayer, I'm pretty uncomfortable with that. I'm pretty unhappy with that. Such behaviour will not be tolerated. The companies must now face the consequences of their illegal action, according to the CEO of the Competition and Markets Authority. Now, I've just got a few extra references here. But now, this process seems to have been going on since 2012. Now, this was actually published July 21st of July 2020 from the government. But the process has been going on for years. So just a few extra references. I'll put a few down here. I'll put these in the links, of course, as always. Reputable journalists giving the links. So here, for example, is the link from what's this one from? Medscape UK, discussing it there. This is the Competition and Markets Authority themselves. This is to do with a process, legal toing and froing. This is a developmental report on the ongoing whatever you would call it, the ongoing process. But that's from 2016 from British Medical Journal. This is from the Times. This is from Reuters. This is from the Guardian, and that's from the Financial Times. So it's in a wide range of reputable sources as well as the original government source. So that's the end of that talk about Pfizer. But if I went to a shop, and they charge me 25 times more than something is worth, say, they charge me £50 instead of £2. I'm not sure I'd rush back to that shop, because I would be suspicious that if they'd overcharged me for one item, they might be overcharging me for another item. Now, this is nothing to do with Pfizer. This is just me talking about my personal prudence. Now, I wouldn't go to that shop. In fact, I probably wouldn't trust too much that shopkeeper told me, actually. And this is so important because we need confidence in our pharmaceuticals. So what is to be done? Well, these generic pharmaceuticals, they've been around for years. I mean, I was given this out when I was a young staff nurse. In fact, I'm pretty sure I gave it out when I was a student nurse. And over the years, and I've certainly taught people about it over the years as well. I feel that the manufacture of these generic drugs should be done by the government. I think the government should start a generics drug factory, bash these things out. They cost essentially nothing and save the NHS millions and millions of pounds. Over time, billions of pounds, I would imagine, because we can make these generics ourselves easily, quickly, and really quite cheaply. Most of them are very simple molecules, and we could literally, competent pharmaceutical factory run in the public interest could produce these things by the ton, literally by the ton, for very, very low prices. So I'm not quite sure why we are. Now, I'm aware that's a bit political, but that's what I think. I think this manufacturing should be done by national governments. Basically, I think pharmacology should be, and pharmaceuticals, certainly generic pharmaceuticals, should be made by the people, for the people, or whatever it is, for the people, by the people. Gettysburg Address, isn't it? Of the people, for the people, by the people. But hey, that's only me. Now let's finish on a much more positive note. This is interesting. I've got an interesting comment from Elizabeth, and talking about the previous video we made earlier on. It's very strange this video came out at this time. I've tested positive this morning for the first time ever after 2.5 years. So we were talking about people not testing positive for a couple of years, 2.5 years, then all of a sudden it's caught them. But Elizabeth was also passing urine more frequently. Now, we don't know whether that's a link or not. It probably isn't. It probably could be coincidence, but it seems a bit of a coincidence that we reported on it there and Elizabeth picked up on that. So there you go. I agree, Elizabeth. It is a bit strange, and we'd keep an eye on that. You'd like to know more about it. I'd like to know more about it. If it comes to anything, we will certainly report it. But for now, it gets a question mark. So there we go. UK government opened a big generic drug company making pharmaceuticals, and I think we can all save a lot of money. And while you're at it, you could start a research institute as well. But there you go. Thank you for watching.